Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In this video, it's now 10 days since New Year's, so let's see what the impact has been. And spoiler alert, it's not pretty, but the tide may be turning, and there is something you can do about it. So please share this video with someone you care about. So here is the current curve of cases in North Carolina, and you certainly recall the surge in cases that started before Thanksgiving, briefly flattening, maybe going down just a little bit, not declining enough before the post-Christmas surge. And again, only a minor decline before heading into New Year's. And so the spike following New Year's has simply accelerated on top of that. And you may recall back in March and April the great concern with a surge in cases that really overwhelmed area hospitals. Well, we didn't see it then, but we are about there now. Since New Year's, area hospitals have seen a doubling and tripling of admissions, including people needing ICU care. Doctors are coming to work in emergency departments with beds full, people in the hallways, ambulances waiting hours to turn over patients, ICUs full. And because many of these patients must be in the hospital for days and even weeks, the strain just builds and builds. Doctors, nurses, and staffs exhausted, and worse, demoralized because so many aren't appreciating the struggle they are facing each and every day. All 50 states now in the red. That means all are seeing greater than 25 new cases per 100,000 population on a 7-day rolling average, and most are well above that threshold. I've often used North Dakota for comparison, and remember in mid-November they were at 216. Now they have the second lowest rate in the whole country at 29. They're averaging around 217 new cases a day. And for comparison, North Carolina right now, about 8,500 new cases a day. So what we're seeing here is not inevitable or permanent. Zeroing in on the southeast, other than South Georgia, everyone very red, well above the 25 new case per day per 100,000 population threshold. North Carolina, all 100 counties are in the red. In western North Carolina, rates remain very high, everyone well above the threshold of 25. But in some instances, some counties are down a bit from their January 4th post-Christmas numbers. Haywood County now at 2,708 cases. Currently there are 406 in isolation, and that's by far the highest number since the pandemic began. And recall, at the end of November, we had reached our first 1,100 cases in the pandemic. By the end of December, we reached the next 1,100. And in January, we've already added close to 500. And a very concerning trend is the number of people who refuse to work with the health department. Currently, there are 44 who should be in isolation, and we hope that they are, but they may not be and may be endangering those around them. We hope not. Test positivity rate, remember below 5% is the goal. North Carolina currently 13.9%, Haywood County 14.3%. In Jackson, 19.7, Macon 23.1, Buncombe 11.4, and Henderson 12.7%. Again, all well above that 5% threshold. So what was predicted, unfortunately, has come to pass. Not enough of us heeded the warnings. And so the Christmas spike on top of pre-Thanksgiving surge and now New Year's spike. So where in this is the positive news? Because rates are high, test positivity is high, hospitalizations are high. Well, if you look closely, 6 of the western North Carolina counties have rates actually that are down since January 4th. Now the hospitalizations are higher everywhere, but we know that hospitalizations lag case counts. As case counts come down, perhaps hospitalizations will follow. For Haywood County, you can see the curve flat and now trending down over the past couple of days. We expected these surges to peak after 10 to 14 days, and have we seen that peak here? We'll know in another week or so. And another piece of positive news, so far around 2,100 people in Haywood County have been vaccinated with no serious reactions noted. We'll keep giving vaccines as long as the supplies keep coming, but right now, vaccination alone is not enough. This is a really critical time. We need cases to continue to decline. We need hospitalizations to head down. So this is what it will take. For the next 2 weeks, choose to make a difference. It's no longer a matter of sticking to opinions or beliefs. This is the reality, no matter how much none of us want it. And so here's what to do. For the next 2 weeks, choose to avoid gatherings, especially indoors. And if you must, choose to wear a face covering. Keep your distance. Limit the time together. This means restaurants, family gatherings, religious gatherings, and please be careful at work. These are the places we have seen and continue to see transmission occurring. Just for the next 2 weeks. Every one of us. Just don't do it. Even those of you who have not been willing to make this kind of choice, especially you, your family, friends, and neighbors, those in healthcare, struggling to take care of those who are ill, they deserve our support, your support. It's the least we can all do right now. So be well and be careful. There's no more important time than right now.